industry doing? It's lobbying like crazy at present around its so-called harm reduction agenda. And the industry is particularly focused on trying to sow division and to sow a narrative that these new categories of products are reduced harm products. But the reality of the situation is that these products are being marketed as consumer products to the world at large. And as I've already said, they have sweet flavours, they have bright colours, they have characteristics that are specifically attractive to children and young people. This is not public health harm reduction. This is uncontrolled, this is not pursuing a public health agenda, and this is not monitored with public health goals in mind. Thanks very much.
Thank you very much, Ben, and a good moment to remind everyone that tomorrow at, I think at 3 o'clock, the WHO Framework Convention for Tobacco Control, FCTC, had a press conference where you could also tune in virtually. Thank you. Next question goes to Geneva Health Files, Priti Patnaik. Priti, please go ahead.
Good afternoon. Thanks for taking my question. We wanted to know about any preliminary assessment that WHO has done on the US bilateral contracts with certain developing countries on accessing biological information in exchange for aid. There is apprehension that this could directly affect the pathogen access benefit sharing negotiations at WHO and the wider PPR agenda. If you are able to comment on this, that'd be great. Thank you.
Thank you, Priti. And I think we have Steve Solomon, our principal legal officer, online. Steve, if you're there, please go ahead.
Yeah, thank you, Christian, and thank you, Priti, for the question. This issue of the U.S. initiative in this area came up during the most recent session of the Intergovernmental Working Group, IGWIG 3, as we're calling it. I'm sorry, I'm out of focus here. The member states are closely following this issue. The organization, the Secretariat, is working to support member states in that, and we will continue to follow these developments, ensuring that the work of multilateral, fair, equitable access and benefit sharing system is advanced in accordance with the Pandemic Agreement and its Article 12, which was adopted by the World Health Assembly, is critical for the organization and for its member states. The objective is to deliver a multilateral pathogen access and benefit sharing system to the Health Assembly in May of next year for its approval, so that the Pandemic Agreement and this system, which will ensure better access in the face of future pandemics to vaccines, therapeutics, and diagnostics. This is critical for the organization and its member states. And so we will continue to work in that connection.
Thank you very much, Steve. Next question for NBC News, and that's Erica Edwards. Erica, please go ahead.
Can you hear me okay?
All good.
Thank you so much. So my name is Erica Edwards. I'm with NBC News, and I'm wondering if someone could please speak about H3N2, which is getting a lot of headlines from the UK and Canada. Apparently a worrisome strain of the flu circulating early. The CDC here in the US isn't releasing any information about the flu because of the shutdown and so many layoffs at the agency. And I'm curious whether WHO can provide any insights into the spread of this particular flu and what it might mean for the US. Thank you.
Thank you for this, Erica. And we have Dr. Wenjing Zhang. She's unit head for our Global Respiratory Threats Unit. And Wenjing, please go ahead.
Thank you, Chris, and thanks very much for the question. So now we are in November. Actually, for the Northern Hemisphere, we are about to enter into the winter season. And often, this is a season for seasonal influenza epidemics occurring. And for many countries, or for almost all countries, that the timing of start of the season could be varying, but always around this period of time. So in the past several weeks, there were many countries having reporting that their influenza season started. But if we look at historical record of the timing of the start of the season, actually it is not unusual. And your question about the specific H3N2 strain recently reported from UK. So actually H3N2, this is a seasonal strain, and this is one of the several strains like H1N1, H3N2, and E strains circulating and causing seasonal epidemics. That particular strain, and it is named clade or subclade K, this is a small group that emerged since June. And since it's emerged, it's rapidly spreading and predominating in some countries so far in the Northern Hemisphere. So it comes again to the vaccine composition, that the vaccines are being used in the Northern Hemisphere now. This composition was recommended in February this year, basically before the emerge of this particular small group of those. Fortunately, from the early studies, the early estimates from UK, the vaccine effectiveness studies, actually the VE estimates is quite normal or satisfactory, that in the children it's 60 to 70%, and in the adult is around 40% of those. So although the current vaccine composition and the emerged clade of the virus is not optimally cross-reactive, still the vaccines can provide the protection of those. Your another question is about the vaccination policy in countries in US, and it's always national authorities, regulatory agencies, and authority recommend their vaccination policies in their country. And from WHO, the SAGE group, the Scientific Advisory Group for Immunization, actually highlight the risk groups recommended for receiving seasonal vaccines, and that includes like healthcare workers, people with underlying conditions, pregnant women, and the older adults, indeed. So this position remains the same, and with the winter season upcoming, thirdly, we recommend all those, especially those under the risk groups, get vaccinated.
Thank you very much, Wenjing. Now we come to the next question for Ali Withers from Reuters. Ali, please go ahead.
Hi there. Hi, thank you for doing this briefing. My question is for Dr. Tedros, please, regarding COP30. Earlier in this briefing, and there was already a question about it, there was the mention of how the tobacco industry is infiltrating a different multilateral forum. There's there's documentation of a lot of fossil fuel lobbyists being present at the COP. I'm wondering if there's a view on addressing fossil fuels within the work in health, because it's a leading contributor of air pollution, extreme heat deaths, and so on. And if there's work happening at the WHO on this level, or a position or a statement, please.
Yeah, if I may, I could answer this question. Thank you very much for it. Now, of course, there is a need to step out of fossil fuels, and I think that in this COP30, there will be more efforts to reduce fossil fuels. So, as we said, and as Dr. Tedros said, the climate crisis is a health crisis. And so therefore, we need more action and more implementation. We need to go through to renewable energies which are available and effective and efficient, and can create a lot of business as well. So while we have seen a lot of health negotiation or health discussions at the COP, we have not yet seen a formal place for negotiations of health. And what we see from Belém just now, following the discussions there, it is high time that health becomes an issue for formal negotiations, and we hope to see this already at COP31. Thank you.
Thank you very much, Rüdiger. Next question goes to Christiane Oelrich from the DPA. Christiane, hello, and please unmute.
Danke, Christian. My question is going back to tobacco. An expert paper that is to be presented at the COP has measures for the future on how to effectively fight tobacco, and it has suggestions that have kicked up some storm, at least in the German media, about banning filters for cigarettes. I already talked to Ben about that, but I wonder whether WHO has a more of a political answer to this question. These suggestions are considered as extreme in some quarters. Is it maybe not very beneficial to come up with something where a lot of people who are basically agreeing that more tobacco control is necessary would say, well, this goes way too far and diverts from the actual issue of taxation and so on? I wonder whether Rüdiger might be able to answer this, because I know that he's the tobacco specialist from only a few months ago. Thank you very much.
Thank you very much. And actually, your question is related not only to tobacco control, but also to the Plastics Treaty. And here we have a very strong stand. We do believe that it is high time to ban those plastics because we don't see the health benefits of plastic filters. We see that this is or has been the same tactics of tobacco industry to say, well, filter cigarettes are less harmful. It goes back to the same argument that Dr. McGrady has made just earlier. And we do not see the health benefits of these filters. So therefore, they must be banned because they are the highest pollutants in waters, in oceans, of these plastics that are contaminated also with toxicants. So therefore, yes, we do call for banning these filters.
Let me see if anybody wants to add anything. Oh yeah, Dr. McGrady.
Thanks, Christian. Yeah, just to add to the comment from Rüdiger and answer the question, Christian, about whether countries should be prioritizing the ban of filters or other measures. First of all, when we think of tobacco control, we think of a comprehensive set of interventions that governments take to reduce demand and supply. So it's not an either or. Governments need to take different interventions that complement one another to achieve the goal. I think we are eagerly anticipating a proposal from the European Commission for revision of the EU Tobacco Products Directive. And there are a number of different ways in which Germany and countries in Europe can further strengthen their tobacco control laws. One of the issues that we're talking about today are some of the newer generation products, electronic cigarettes, nicotine pouches, heated tobacco products. These were not addressed in detail in the 2014 EU Tobacco Products Directive, and we would encourage the European Commission and EU member states to strengthen their regulation of these products and take the opportunity of a revised directive to do so. We think that they can make substantial progress in tobacco control and address what is a serious issue now of use of these products by children. And just to give you one statistic on this, when we talk about e-cigarettes, the latest data that we have shows there are 15 million children worldwide using e-cigarettes. And in countries that have data, we see use rates among children 9 times higher than among adults. It's clear that it's time for Germany, for the EU member states, and for countries at large to take strong action to address these products. Thank you.
Thank you very much, Ben. And this brings us to the end of our briefing. I thank you all very much, and I thank the panelists here and those online. We will send the post-presser remarks and Dr. Tedros' opening remarks very soon after the briefing. And with this, back to Dr. Tedros for closing.
So thank you very much again to the press for joining us today, and see you next time.